I've mastered the worrying mother. I feel like you worry about everything, but my largest worry would be, how do we keep Aiden as healthy as possible until the cure comes?
Cystinosis is a really rare disease where parents who are perfectly healthy are carriers, don't even know they're carriers. They have a child who happens to be affected, and it's one of those random things that hits you out of the blue without any warning.
It's not every day that it's easy for him, and some days are harder than others, but he fights through. He's incredibly tough, and at the end of the day, and almost every beginning of every day, he has a huge smile on his face.
Cystinosis is a genetic disorder, so this means that one gene has mutation or deletion, so it's a gene that no longer works. This leads to what we call a multi-organ degeneration, and so they start losing their kidney function, and then after require kidney transplantation.
Can affect muscles, bone, central nervous system.
Trouble with the eyes because there is an accumulation of cystin crystals into the eyes.
Basically the entire body. When Aiden was diagnosed, the doctor told us that this disease, cystinosis, could require more medications than most other known diseases.
When I started doing pediatrics more than 30 years ago, cystinosis was one of these horrible diagnoses that said your child is going to be sick the rest of their life, however long that's going to be, and they're going to die young. But through research, things have changed.
Thanks in large part to the efforts of the CRF, the game has changed dramatically from 30 years ago. Because now at the end of the tunnel, we see a cure.
Even though he has this disease doesn't define him. It doesn't make him who he is. He is very much a normal, quote unquote, 2.5-year-old who wants to go play all the time. I'm so proud of him. I couldn't have asked for a more perfect child.
What I love about Alex is what we have in common. We have a lot in common. Of course, cystinosis, but that's not just it. Our lives are very similar with medical issues. I do believe she was meant for me and changed my life. Now we're married and one day hope to start a family.
I love a lot about Brian. There's a lot to love. I love how strong he is with everything that he's been through. I had to be hospitalized a couple of months ago, and he was there right by my side. He's an awesome man.
As a small child, it was more just medication. Around the clock, all the time. Can't skip a dose. Like brushing your teeth. It's a part of life.
I do take daily the same thing as Brian. I take about 40 to 45 pills a day. So of course with the hope there are fears, especially with Brian and I both having cystinosis.
I think one of the biggest things that worries myself would be the muscle wasting. I've experienced that with my hands, feet, and my shoulders. I have noticed there's things that I can't do what I was able to do.
Like if Brian were to get sick, or even just like with his muscle wasting, like right now I help him. I fear that with the muscle weakness, that maybe one day I can't help him with certain things.
It's the way I was raised. My parents, I've always been positive. It could always be worse. But I think they've come a long way and there will be a cure.
One of the problems we have with cystinosis is you can take all the medications you want, but the medication doesn't get into your tears. And so people with the eye disease have to take drops every hour, all day.
I think about patients like Alex and Brian. The burden of having to treat this disease with these eye drops so frequently can be so cumbersome. I just think that this is an area where we can really maximize the quality of life for these patients in terms of their vision. What we're hoping to offer is a treatment that is used less frequently, that's less irritating, and a bit easier all around for patients and their families to administer. When you work in a rare disease field, It's often difficult to imagine that it could really benefit lots and lots of patients. The work that led CRF to fund us was in glaucoma and in ocular infection. If we're able to translate the technology for other diseases, it's going to be largely due to the help that we've gotten from CRF.
The moonshot is the cure. The stem cell research, which has been funded by the Cystinosis Research Foundation, will be testing using some of these new genetic techniques.
What we are going to do in the patients is to take their own stem cells that we get from their blood, and in the laboratory, we will gene correct.
And then give the patient back their own stem cells and allow their own body to cure their disease.
If this treatment is successful, this means that it could be a one-time therapy that could last for the life of a patient. We are doing a phase 1/2 clinical trial directly, not only a phase 1. It's also a low number of patients, it's 6 patients, and they will have to be followed for 2 years. If it's safe and efficient, then we can go directly to phase 3. So this saves time in the process of bringing this therapy to patients. The commitment will be enormous, but the benefits could be huge.
Once the stem cell therapy works and is figured out, hopefully we'll be able to identify these children through screening even before they're born, and maybe do the stem cell transplant while they're in the womb so that they don't even know a day of being sick in their lifetime.
Although our son has this horrible disease, he has a family that loves him, a broader community that's advocating for him, and a very bright future.
Honestly, I never thought the word cure would even be mentioned. With Dr. Shirky's determination, I think there will be.
So we can live a long, hopeful, strong life together and be that cute little married couple walking down Main Street kind of thing.